in our series of enhancing experiences in long-term care. The HQCA has been surveying long-term care family experiences since 2007, and our population in long-term care is becoming increasingly complex, and often the care needs of seniors is becoming uniquely individual. The desire to improve among the continuing care provider community is higher than ever. As such, we believe that finding ways for facilities to foster and encourage meaningful family input is a vital step in making positive changes and improvements in resident care and experiences. The first 4 parts of our series identified a number of long-term care facilities who have demonstrated some improvements in their operations and their experience that have led to improvements in experience in their resident care experiences. You can go and find that information on www.hqca.ca/QE. Today we'll ask our audience to be involved in an interactive web call with our family panel. And so in order to do that, what we'd like to do is have a little bit of a practice with how to chat in the Zoom feature. So if you can see the screen right now and you roll over to the top of the screen, you should be able to see, or at the bottom of the screen, you should be able to see the chat function. If you're able to do that, that's great. And what we'd like to do is have a practice chat. And that question for you to respond in this practice chat is, as the summer season is approaching, what is your favorite summer activity? Okay, we see gardening, cycling, hiking, camping with family, family picnics, music festivals, anything outdoors. Sounds like my kind of summer, you guys. Awesome. So everyone is looking forward to the summer season. That's really good. And so now that you've become acquainted with the chat function, this is something that we'll use throughout the session. Feel free to use the chat function to type in any questions you might have or any comments that spur interest if you'd like to respond to any of the family panel comments. For those of you on the phone, you'll have an opportunity to ask questions throughout the conversation, but we offer the opportunity to ask those questions once the family panel discussion has concluded. Great, so we'll move on from the chat. So a couple of other features of the webinar that we'll be doing today are something called a poll. And so we have a couple of questions just of the audience today, just to understand who you are and a little bit of your background. So our first question is, have you had a family member in a care facility? The second is, do you currently have a family member in a care facility? And the third is, which category below best describes you? So a member of a resident family council, a family member, or a volunteer at a care facility, facility management, or other. What I think we're seeing right now is a record response rate of 81% in 50 seconds. So it's absolutely fantastic that you guys are so engaged and ready to interact with us. It's great news. I'll give it a few more seconds and then we can get into what we're here for, and that's listening to our family panel conversation. Okay, I'm going to end the poll in 5, 4, 3, 2, 1, and that's been ended. And so today, today's session will be facilitated by Geraldine LaRue and Leona Ferguson. Both of these are members of the HQCA's Patient and Family Advisory Committee. I'd like to now pass the microphone over to Leona and Geraldine. Thank you for joining today.
Good morning. My name is Leona Ferguson, and I'm here today as a member of the Patient Family Advisory Committee. I've been a member for a year and a half. My background is nursing, and worked for 42 years in different parts of nursing. And I'm retired now for the last 4.5 years, so happy to do that. I'm glad to be a retired nurse. I have a mother. My mother is in continuing care right now. She has a severe dementia and has had that for the last 4.5 years. So about the time I retired, I was lucky enough to be able to be close to my mother and to be part of her care. I'm her advocate and I'm her guardian, and I spend a lot of time at the facility helping with making decisions about her care. So I'm very involved with care, and I'm glad to be here today to share this information with everybody. Geraldine, go ahead with you.
Hi, I'm Geraldine LaRue, and I come from the Health Quality Council Family Advisory Committee as well as Leona, just finishing up my term with them. And I too have members of my family in care. I have a mother with severe dementia, just like Leona, so being an advocate and guardian for her. And I also have a brother with MS that's in SL3, or sustained level 3 care. So that's a little different. I live in Lethbridge, and they're on opposite ends of the city, and just the way you figure it out. So very, very involved with trying to help both of them out. I have an education background as a teacher, but left that profession after about 28 years, and I'm currently an employment specialist with a company called Teamworks Career Center. So I'd like to introduce our panel members today. First, we have Anthony Chan. Anthony is Vice Chairman of the Wing Kei Family Advisory Council. And then we have Sam Stevens, who's the family alumni and current volunteer at the Sherwood Care, and Joanne Weller, who is representing Westview Care Community, and Frank Maynard, who's representing Rivercrest Care Center. So we'd like each of you to take about 30 seconds or so to introduce yourselves, and we'll start with Anthony.
Yes, Anthony Chan here. I have been with the Wing Kei Family Advisory Council for just about 3 years. My mother-in-law has been the resident for about 3.5 years. And over this time, I found that to be a very positive experience. And my aim is just to share the experience, and hopefully we can implement some helpful suggestions and recommendations for all senior care services.
Thanks, Anthony. And we'll move on to Sam next.
I think we're just waiting for Sam to still call in. She's had a few technical difficulties this morning. So.
All right. Maybe we'll move on to Joanne then.
Can you hear me?
Yes.
Okay. Good morning, everyone. It's Joanne Weller. My husband's been a resident at Westview Care Community for the past 5 years. Westview is located within Nehill County, just outside the corporate limits of the village of Linden, and I live in Linden. My husband is one of the younger residents at Westview. He just celebrated his 70th birthday, so we're expecting to be there for a number of years yet. He was diagnosed 10 years ago with Parkinson plus syndrome, which is a progressive disease that can either take you quickly or take a long time for you to succumb to it. So anyway, that's about all for us right now.
Thank you, Joanne. Frank, are you available to speak? Hello, Frank.
It looks like Frank's on mute. There he goes.
Frank, yes, if you can unmute yourself.
Hang on a second.
Oh, you got it.
Okay.
Are we on?
You bet.
Okay. My wife Doreen has been in Rivercrest for just over 5 years now. She has no use of her legs, so she's in a wheelchair. It's very difficult to take her out anymore. I did take her for drives around this part of the province, but as I can no longer manage get her in or out of the car easily and have a fear of losing her at the front gate and having to call an ambulance, she no longer gets to go for any drives. However, that's the way it is for us. I visit her every day and I find everything goes well here. The staff know me, and that's half the battle. And I think that's about it for the moment anyway. Thank you.
Thank you, Frank. Is Sam on yet?
Can you hear me now?
Yes, Sam. Thank you. Go ahead.
Okay. Hi, I'm Sam Stephen, and my mom Audrey called Sherwood Care home for 2.5 years, and I had her at home for 5 years, and then I had to make the decision to get her into full care. So that was our journey, and she's been gone for about 1.5 years now, but I still volunteer at Sherwood Care.
Great. Thank you very much. Thanks. Thanks, panel members, and we'll be calling on each of you just in a little bit. So I will turn it over to Leona, and she's going to begin our panel discussion.
Okay, so it's great to have you all with us today. And we'd like to move into the panel discussions, and we're going to start with the Westview discussion with Joanne. In our discussions, the concept of being heard always seems to come up. How do family members feel that their voice is being heard and making a difference? We can look at Westview, who has a concrete example of improvements at their facility. They changed the way they offered breakfast after they identified it was a challenge for both staff and residents. Joanne, how do you feel your voice or the residents' needs are heard when changes are identified at Westview?
Can you hear me?
Yeah, we sure can.
Okay. The Westview organizes a bi-monthly resident council meeting, they call it, every second month, I guess it is. Family members are all invited. Whether or not they come or not, I guess, is up to them. I've been to every one just because I'm out there visiting a lot. It seems that the main concern with the residents is basically the food, and I think the food out there is excellent. It's run by the Mennonites, and it's all very home cooked meals. But after you've been there for 10 years or whatever, it gets kind of the same old all the time. Anything that ever is complained about is addressed right away and taken care of. Most of the time it's just individual concerns, i.e. somebody doesn't like a particular food, for example, soup. That's one resident out of 37, so the other 36 like soup. The kitchen staff seem to be very accommodating in regards to that, and will either keep that off their plate or offer the alternative all the time. And like was said earlier, the breakfast buffet was implemented some time ago. I'm not sure how long. It runs to 10 a.m. Some residents like to sleep in a bit, so the breakfast buffet was a perfect solution for that. It also helps the staff by not having to rush in the mornings and get all 37 people out to breakfast by 8:30 in the morning.
Joanne, can you talk a little bit about how they decided that it was an issue and what the steps were to resolve it?
I think because some people didn't want to get up, but breakfast was served at 8:30 in the morning. And so if they missed that, then the nursing staff was making them toast or doing something for them in that regard, because the kitchen staff was then on to lunch, right?
Right.
And so somebody came up with the idea that they would try this breakfast buffet, and it's been a huge success. So the residents still get to choose what they want to eat, like whether it be porridge and toast or fruit and whatever. There's quite a large selection of stuff on their menu. And of course, then some people have special menus as well, right?
Sure.
That's taken care of. So I don't know that much more about it. The place where they eat is very sunny in the morning.
Uh-huh.
It's kind of a hallway, but it's all lined with windows on both sides. And they have two places for residents to eat. One is that way, it's called the garden room. And then they have the main dining room where the people that require some help to feed themselves, that's where they eat. And of course, it's way larger than the other one, but everybody seems to be happy with that as well. It took some time for people to accept that change, but I think now they're all quite happy with it.
Okay. Well, that's really good. Thank you. Is there anything that you would like to talk about as far as any issues that have been identified that are not working so well there with this change, and how those would be resolved?
I know some that we're working on right now. We just had a council meeting last night, and there was a couple of things brought up. And one was the air conditioning, because a lot of the older people get cold and they find it way too cold in there. And they don't have air conditioned rooms. They only have air conditioning in the hallway, but they keep that cold so the rooms stay cool. And the other one was bedtime. They tend to want to put people to bed way too early, like 6:30. And so we're working on that to see if we can't, get it a little bit later. Some people want to go to bed that early, but other people don't, and some family members don't feel it's good for them to go to bed that early.
Yeah.
So
that was at resident council meeting that you identified those issues. Is that correct?
Yeah.
Yeah.
That's correct. Yeah.
Okay, that's good. Thank you. Hey, Geraldine.
All right, we're going to move on to Wing Kei right now, and looking at their communication and recruitment for positive relationships between family and staff. So Wing Kei puts an emphasis on the importance of the patient and family-centered care aspect or concept. The staff are very in tune with the communication from family and how to support them. They even implemented proactive telephone calls, and now ensure an experienced staff member is available in the evenings. They learned that better communication allows the families to have a say in all things. So Anthony, do you think the improvements that Wing Kei has made with regards to family communications has improved relationships and trust with the staff?
I do think so. I think this is a very positive move that Wing Kei made to, in order to communicate with both the staff and the family members. And so far, like for example, the proactive phone call, I find it to be very informative. And one of the reasons to implement that is just that sometimes family members saying that every time they see a call coming in from Wing Kei, they always, kind of worry for the worst, So this type of phone call on a regular basis kind of train them to understand that, it might not be bad news that they're calling, and the call generally just update information regarding the family members about their loved ones and how well they're doing, and it is very informative and helpful. And with respect to the evening leadership program, I think that that is an excellent idea. About a year or so ago, there were some family member kind of concerned that they feel that most of the experienced staff, the ones with more seniority, would tend to pick the morning or the afternoon shift, so that that we're kind of leaving evening and nighttime with staff that are not as experienced. So with this program, family member have been feeling more secure and more confidence in the evening time, that their loved ones are being well looked after.
Oh, that's good. Has this allowed you to feel more involved in the care decisions with the communication aspect?
Yes, we at the Family Advisory Council level, we try as much as possible to put in as much improvement in communications. I think that's very important.
Right. Do you feel this better relationship has led to people wanting to be more involved in the Wing Kei Family Advisory Council as well?
Definitely. Like, I've been with the council for over 3 years, and at the beginning, it seems to me that some of the members are not as interested. Within the last 6 months, I can see that they have more and more confidence about the input being heard by the management, and they have seen that improvement were implemented.
Right. When do you think it's natural for a family member to begin getting more involved? When does that process begin, do you think?
When?
Mm-hmm.
Okay.
With the Family Advisory Council, sorry. So,
well,
go ahead.
Sorry, you go ahead, yeah.
Well, just that it's kind of overwhelming at the beginning when a family is putting their family member into care. Mm-hmm. So it may take a little bit of time before you feel comfortable to be on the Family Advisory Council. So when do you feel that might be a point, or is there any kind of sort of specific?
I think, to be fair,
when do you think it's natural for that to happen?
Yeah, I think, to be fair, I think the family members should at least spend like 6 months to a year to understand exactly, how the operation is done, and how the management, manage all different aspects of the services, and then they have a better understanding. They can give better inputs.
Right. So getting involved a little too soon, you don't really know how the whole structure works.
Exactly. Yeah.
Okay. All right. We're going to turn it over to Leona for our next panel member.
Okay. So the next one we're going to talk about is Rivercrest. I thought what we got Sherwood Care up on the. There we go. Rivercrest Care Center. I got a little nonplussed for a minute. I thought my notes didn't go match with the overheads. Rivercrest has involved the input of family members to develop a family-focused admission process, a commitment to building relationships, and an open door policy and interdisciplinary teamwork. We know that at times it can be challenging to achieve two-way communication and to become involved in the facility where our loved one resides. In the quality exchange, we learned that one of the areas of significant improvement for Rivercrest was in the survey category of providing information and family involvement. Frank, can we talk with you for a minute about Rivercrest? Can you provide some examples of meaningful ways that you were able to make strong connections with the leadership team at Rivercrest?
Well, I've been at it for 5 years, and I just got to know the various members of the staff. And I think that's probably as good as anything here. We obviously, staff change from time to time, but if you keep in touch with them, then I think that's probably as good as anything we can do here.
Right. So they worked on the admission process, and I know it's been a while for you since you walked through that process with them for your wife. But can you remember sort of what that process was like, and help us with understanding how they do it that makes it feel good?
Well, I've got to admit, 5 years, my memory's getting a little shady at that point.
All of ours are.
It is, but no, I was taken around by Graham, the social worker here, and he showed me the whole facilities. And actually, I watched him go around with other people. I was introduced to various senior members at the time, and I can't remember who or what, but as I said, that you get to know the members.
Right.
When you have the time, when you're here, I come in visiting every day, barring the time I'm away on holidays and things. So the staff know me, and I keep in touch with them. I sometimes see the RN that's on duty, not often because they have duties to perform. And I think that's probably the key thing, even down to the people in the kitchen who I get to know very well, even though I don't dine here. But I like to keep an eye on what is going on. And so that's about it as far as I'm concerned. You just keep in touch with the senior members as you are able.
So do you feel like there's an open door policy there that you can go and see them when you need to?
Yes, definitely. I made reference the other day to one of the staff that, if I have a problem, I used to be in management years ago, and I will go, if the push comes to shove, I'll go to the manager, guy here. I haven't had to, but I don't expect to have to because things go along pretty well. Oh, we all get out of bed the wrong side sometimes. That's human. And I just take that in stride. But no, I think the staff are doing their best to keep all of us informed. And I've seen them where, I had a couple of guests here get a little cheesed off at me for any reason, whatever they feel, even to the point of wanting to grab my hand one day or my arm. But okay, the staff come along and straighten it out. So you have to recognize that everybody has a job to do here, and you're impeding on them when you're here. You could be impeding things, but anyway, it usually comes out quite well.
Yeah. Do you feel like as a family member you're appreciated when you come to visit your wife?
Yes, because you can help out if necessary in wherever. Now, in my wife's case, she needs help for everything, and that's not possible for me to help out with.
No.
But by that, I take her downstairs, and we visit in the lodge here every day, and the staff will visit with us if depending on, or I make a point of that too, because the job I had asking questions was normal. And so I do get in touch with the staff, and there's some of them that have, we have a member here that one of my daughters is very friendly with, and she pays close attention to my wife.
Oh, that's
and I
good.
think this is very nice.
Yeah.
Others do too, but I just happen to think of one member that I know quite well too.
Okay. All right. Thank you, Frank. That's good.
All right, I guess we'll go to Sherwood Care Center now. So from the HQCA's interviews with Sherwood Care and their work in developing the dignity and death protocol, it was learned that families want to be heard and understood. They want staff to be honest with them, and they want access to people. So families need to know who to talk to and where to get answers. As a family member with a loved one in care, I believe that we all have these wishes. We'd like to call on Sam now. Sam, your mother was in Sherwood Care, and you described the strong relationships you had with staff in the Quality Exchange article on Sherwood. You are now a volunteer at the facility. So what do you feel are the most important things for developing strong interpersonal relationships with the care team?
Well, our family got to know the staff quite well, and we got to know them on a professional and a personal level. The staff there were like mom's family, so that's how we treated them. And we asked lots of questions, and any way that we could help out, we wanted to learn how to make things better for mom. So I was constantly asking, the healthcare aides, how I could help mom, if they could give me little hints how to you know, keep her comfortable and do the day-to-day tasks. And I just honed in on using the staff's experience and their knowledge. And whenever I had questions on medical problems, I'd go straight to the RN and just ask them to walk me through what was going to happen with Mom in this situation. They knew I was a person that needed to be informed, so they got to know each and every one of us in the family, and were really helpful. Just, you know, getting through the different things that came up, and yeah, so they were really informative.
Oh, that's great. So
Yeah.
when do you feel you had a personal relationship with the staff? At what point do you feel that sort of present?
It happened pretty quick for us. We were there quite a bit, and just everybody was like family, and you know, we trusted them with Mom, and yeah, our relationship, it was pretty fast, and we got to know the staff, and yeah, it was a family environment, definitely, and still is. I go back, and you know, everybody, it's lots of hugs and kisses, and you know, just it's a good family environment, and got some special staff there.
Oh, that sounds like you had a really good connection. Thank you. Leona, we'll take it over to you now.
Okay, so now we're going to move into a panel discussion, and we're going to ask our panel members all to participate in this. So the question that we're wanting to pose is, as a family member, when your visit is over, what helps you feel okay when you leave your loved one in their care? So when you've been there for a visit and it's time to go, what makes you feel good about being able to leave that loved one there with the facility? Can we start with you, Joanne?
Sure. Can you hear me?
Yes, yeah.
Okay. I don't have any worries about leaving my husband there. The staff, I find, treat everybody the same. They treat them as though they love them like they're their own parents. My husband never complains about anything. He's always happy, joking around with the staff. They joke right back with him. And that just makes me feel comfortable knowing that he can be happy when I leave there.
Okay, anybody who else wants to add anything? Anthony, do you want to jump in?
Yeah, I think that I probably feel more comfortable if I have the confidence that the staff is going to look after my loved one well, and also, like, you know, the atmosphere of the nursing home and the friendliness of the staff. Also, that, you know, we have the confidence that that the staff are well trained with knowledge, good knowledge, and capability to do the job. So I guess in a way, training of the staff, and particularly in communicating with the family member, is very important, so that they understand that, you know, your loved ones in good hands.
Okay, Frank, how about you?
Well, I find that as I the other last gentleman's statement, the staff, they know their jobs. And as far as leaving Doreen, I like to know she's got something to read. She used to be a librarian, part of her duties in years gone by, and so reading was quite important. So I like to make sure she has the daily paper that comes here. Also, I bring in the odd magazine from the family. And when I leave, it's a comment that, well, see you again tomorrow at approximately 2 o'clock is when I usually visit in. And we leave it that way, and we go up, and it's worked out very satisfactorily over the years.
Good. Okay, Sam.
Yeah, and with me leaving Mom after a visit, of course, I could just feel the love and compassion that the staff had for all the residents. And also, if there's ever a problem, I would just phone, and I always got through to whoever was at the desk, whether it was the RN or the LPN, and I could ask my questions. And if there was ever an issue on their end, they would phone me and keep me informed of what was going on with Mom. And there was good communication that, it was just a phone call away, whether I'm phoning or they're phoning me, and that meant a lot.
So it sounds to me like it's communication, an open communication, and knowing your family member, the staff knowing them and appreciating them for who they are. Those are the things that help you to feel comfortable about leaving your family member with them. Is that right?
Yeah. Yeah, you bet.
Yeah. Joanne? Anthony? Frank? Any more comments? Anything that comes to your mind with that?
I don't think so. I just agree that it's communication and the happiness and contentment of the loved one that's left there. I know there are some people that, don't like their family to leave them. And I'm just one of the lucky ones, I guess, that he knows that's his home now and he's fine with it. So.
Yeah, that's good. Okay.
I guess it's kind of important to know that your loved one, is just not sitting there all day long. They have all kinds of activities, and some of the staff, they are genuinely concerned and have a good golden heart to look after your loved one.
Mm-hmm.
Yeah. So in doing what they say they're going to do you feel that that's important as well?
Yes.
Yeah. So part of it's a formal care plan, but part of it's just the commitment every day to doing things like making sure the paper is there for your wife, Frank, those kind of things, right?
Yes.
Yeah.
And then, okay, for other visits, I go in there. She likes to have me take her if we're going to something that's being performed for recreation. That she's deaf in one ear, has a hearing aid for the other, which she never uses, so she's almost deaf. So she has that problem. So it's no use getting involved and say a bingo. She's not going to hear it.
Yeah.
Other facilities, I try to come along as with the recreation people know that, and they often she'll wait for me to come before she'll go.
Mm-hmm.
That's the way it has been. We have to put up with that.
Good. Okay. Thank you.
Yeah, my husband's the same way. He likes to participate only when I'm there.
Mm. Yeah. So trust, that's a word that I think of a lot. It's having that ability to trust the staff, correct?
That's right, yeah.
Yeah. Okay.
Thank you, Leona, Geraldine, and to the panel. Now is an opportunity for our audience to ask people questions. So what you as an audience might be curious about. We have two ways to ask questions. One is via the chat feature, which you practiced earlier in the session, and the other is to unmute yourself and ask verbally. We don't have anything in the chat section right now, so if anyone has a question they'd like to ask via the audio, feel free to do so.
I've got a question at Sam. Do any of the panel, do you have any family members in long-term care? Have you gone through these situations like we have?
This is Geraldine, Sam. So it's interesting. I find that term in itself interesting, long-term care. So my mom is in an SL4, Sustained Living 4, but she'll never leave there because of dementia. So
yeah,
I find the language a little frustrating sometimes, because to me that's long-term care. So I don't know if that's what you're wanting to refer to. It's the specifically designated long-term care that AHS designates.
This is Tony, the host, and I have a question for the panel and even for you, Geraldine and Leona. We've had some great comments from each of our panelists about how they get involved and how they've been involved from a family member perspective. In your experience, for those who might be on the call or listening to this from facilities, or maybe staff in a facility or a manager in a facility, what advice would you give to a facility staff member or a facility manager, for example, about how to truly engage and embrace resident and family centeredness and in that sense? So any thoughts and advice you'd give a facility as they're looking to improve their effectiveness of resident and family engagement?
This is Geraldine again. So for ourselves, with both thinking of both my brother and my mother's situation, it's very important for me. It's been very important to have some consistency in staff. When my mother first moved into her facility, I never saw the same staff twice for months and months on end. Like, they were rotating them through all the different pods and all the different levels, which it's quite a large facility. And so I would never know from one visit to the next who this new person was. So it was very difficult to begin to form our relationship. So from then they've changed that policy, and now there's a consistent group of caregivers in her dementia cottage, which has really changed our ability to interact and develop a relationship. So I see there's a few questions or comments there, Tony, in the chat.
There is, thank you. So Sarah just appreciates the contributions from the family members from sharing experiences, so thank you. From Kathy Fortunate, my dad was in care for 1 year, and we had some challenges with consistent feedback and communication with the care team. As a result, it was difficult for us to develop trust with the care providers.
Mm-hmm.
More of a comment would be any response from the panel.
I guess that's exactly what I was making my comment on there. So Kathy, I totally agree. If you can't build that trust, if you don't get little bits of feedback about how the staff know your loved one and some of their little things they do every day, it's really difficult then to have the trust for the medical side of it as well. So I totally agree with what Kathy's saying there.
Well, I think these staff here have been pretty stable as far as I was concerned. Yes, there's changes from time to time, but I get to know them, even if I don't know the names. I know them visually as I'm coming in and out every day. So I think from our perspective, that's a positive here.
Mm. Yeah, good. How big is your facility, Frank?
How many in the facility?
Or just, yeah.
80, I think, or around 80.
Okay.
We've just recently opened a hospice section here.
Oh.
I think there's 4 in there, I'm not sure. 6 hospice, okay. So that has changed things around a little bit. It doesn't affect my incoming or anything, but I think they had to be aware that with hospice, you have, I think, 24-hour people coming and going, which didn't happen most of the time. So they had to make some changes entering and exiting here. And it used to be, we used to have a little more difficulty getting out, but now it's very simple. Press the numbers and out you go. But that, I think, is one of those things that they've found they had to address. But they've provided it. This is a relatively recent, last 6-8 months, I think, they've had this. established here. And it's, I think, very nice to have it in the facility, actually. Thank you.
Thank you.
Yeah, I also agree that having regular staff really help to build the relationship and also trust. But at Wing Kei, sometimes they do rotate some staff for training purposes. But as long as they don't change a big amount of staff, then I think this should be acceptable.
Right.
Yeah, it seems relationship with the staff is a common theme here. And Diane has a comment in the chat. Where my father is, there seems to be always a constant change of staff. So it's very difficult to get to know the staff or for them to get to know us. There also seems to be a challenge with communication between the home care RN or nurse who does the care plan and the staff at the facility who do the care. I guess what advice might you have for Diane to maybe influence some improvements in that and to really improve the experience for Diane and her family member in care?
So it's Geraldine here. Diane, one of the things I ended up doing, maybe because I just didn't know how the system worked very well, but I ended up calling the home care RN a number of times and just having a chat with her about a few different things and just making sure that I developed that relationship with her. When my mother first, she was changing facilities, so when she came into the facility she is in now, she, what we didn't understand is she got an infection and ended up eventually going into, her kidneys were shutting down. And because of that, I was in constant contact, like a couple of times a week or more with the home care RN. And that really helped develop the relationship. Now, not everybody needs to develop that relationship with the home care RN because of an adverse event sort of thing. But just checking in with them, sometimes it's important for us to reach out versus just always waiting for them to get in touch with us. And then when the home care RNs change, I found that certainly that relationship I established didn't go anywhere with the next person. So yeah, maybe Leona has something on that.
Yeah, I think I just want to echo that as well, that it's important to find out who that home care RN is and then make contact with them and be available to them as well. They have probably a pretty big load of people that they're responsible for. So if you can help them to understand that your family member is special to you and you want to be involved with their care, that will help them to connect with you as well and help them to want to be a part of the care that your parent or your loved one needs. Okay.
We have a lot of great questions coming in through the chat, so thanks for that. Jan Berger says, we're trying hard to address resident-directed and non-institutional language. We try to say home versus facility, choose not to rather than refused. It takes time to change a mindset. Kaya asks, how do you ensure every staff, excuse me, i.e. physician, or every staff member, like a physician, resident, and family, are present during an interdisciplinary team conference and linked it to resident-centered care planning, especially in long-term care challenged with high staff turnover or a high number of beds?
My question that would be, I've had to do a number of these, both with my brother and with my mother's, these care planning or looking at resident care plans. I've only had one time where a staff member wasn't available. Now, from year to year, those members seem to change every time, so all of a sudden there's new faces in there. But I sort of have a separate relationship with the physician than I do with the staff at the facility, only because the physician is not at the facility. I'm not sure, other than this, requesting that everybody be there, that you can do much else.
Yeah. One thing I have learned that I can do as well is go and see the doctor in the doctor's office and have a conversation with the doctor about my mother, if I don't believe that the doctor is able to get to the care conference. So getting some of that information to the doctor and talking about the issues sometimes helps a little bit too, and piques their interest in maybe wanting to come to the conference.
Okay, there's two more, and then we'll move on to a slightly different activity. So from Francine, she comments, I heard from families, relationships, compassion, and friendliness are so important. We're working on this at our homes. We find it easier in our smaller homes to build relationships. We're trying to think of creative ways to improve connections in our larger homes. A question from Linda. What do you think about the physician or physicians that serve a long-term care centre, or if your family is in supportive living, do you have easy access to a physician?
Yeah, Westview, they have easy access. When your family member moves in there, they're appointed a doctor, and there are 2 doctors that take turns coming to the facility on a weekly basis. So right from the start, they have a family doctor when they move in there.
Thank you. So assignment at intake is important, and to be aware of that assignment as a family member.
Mm-hmm.
So we have one other activity, and I've got one question, and would love for the audience to interact. Just type your thoughts into this, and we'll have Geraldine and Leona make some comments to your question. So under the view options section at the top of your screen, or bottom, it can be either. If you click on that, you should be able to see the term annotate, and that's circled on the screen right now. If you click on that and then click the text option from the toolbar, you can then contribute to a whiteboard. And the whiteboard is reflecting on what you've heard today. What's the one thing you might do to make improvements at your facility? So what's inspired you today as a family member, as a manager of a care facility, that you could take away and undertake some improvements in care? Communication is key.
Yeah, absolutely. From both sides. It's important for families to keep communicating all the time too, and not shut down. Trust, trust, trust. Yeah.
One of the comments that I see that I'd just like to point out is this one right here. Putting time into getting to know family members. That's really important. And I think though from the family, it's putting time into also develop some understanding of the staff and who they are at a bit of a personal level. So I think that getting to know each other kind of has to happen from both ends. Yes, very good here. This is, yeah. Sorry, it's not a good start. Right. At all times, we have to continue to advocate for our loved ones. It never stops, right? Even with the best intentions and the best people, things sometimes get missed or go wrong with nobody's fault, and we just have to be able to be there and advocate for them. Right.
Yeah.
Okay, we'll give 10 more seconds for any more whiteboard comments.
Consistency of care is a really good one, and and care partners. I think that comes back to when we were talking about continual changes all the time, and then the families are trying to always keep up with the new people and trying to develop those relationships. In my life, I still have a daughter, 15-year-old, I have grandkids, I have a husband, and I'm working full time. So to try to get the time in to develop those relationships to make sure that care is going to happen adequately for my loved ones in the facilities it sometimes seems a little overwhelming, but yeah, I mean, we just continue to do that however it can happen.
Nothing about me without me. Yeah, those
Yeah.
are good, very good comments. Yeah, I appreciate those comments.
Mm-hmm. Yeah, thank you, everyone. So we might, as we shift the slide here, we might have the comments that stay behind because we didn't quite get the whiteboard up. Everyone was so keen to put their ideas down, so thank you so much for that. This draws our panel discussion to a close today. I really want to extend my gratitude to Anthony, to Joanne, to Sam, and to Frank. All of you have inspired us with your experience, and I really appreciate you opening up and sharing your stories with us and your relationship with your family's care facility. Much appreciated. And to Geraldine, Leona, thank you guys for moderating the session. It's been a pleasure to work with you guys and to even have you share your own experiences. So very much appreciated.
Thank you, Tony. Yeah,
a pleasure. And so for others on the call, for any more information or questions that arise from today's session, you can send us an email at info@hqca.ca. For those of you who tweet using Twitter, you can follow us at HQCA and hashtag Quality Exchange for any comments or reflections that you've had on today's session. We have one more panel webinar in the series for our long-term care experience topic, and that is on Thursday. And we have our leaders from a number of care facilities across Alberta, including our own CEO, Andrew Nuna, who will be moderating that session. That's this Thursday, May 30th at 11 till 12. Should be a fascinating conversation, and would love to see all of you participate. Otherwise, thank you guys so much and enjoy the rest of your Thursday.
thank you.
Thank you.
Bye.
Bye, everybody.
Goodbye.
Bye.